Gentlemen, what about medications that may help? The daily aspirin, Dr. Sanabria?
So for medication to treat valvular heart disease, there are not many medications that we can use, but aspirin is being used mainly for the treatment of coronary artery disease, or obstruction in the arteries of the heart. Yes, it's also being used for stroke prevention, and many times these patients with valvular heart disease, they do have increased risk of having strokes, and then also some arrhythmias that are associated with this valvular heart disease that many times needs aspirin or a more aggressive anticoagulation. So medications is a very important way of treating the patients with valvular disease. And many times we use diuretics, for example, for the patients that are congested, they have a lot of fluid volume overload.
So Dr. Quesada, when would you say, okay, surgery is necessary, it's important? When is it, yeah, must be done?
So that's a very good question. So as Dr. Lopez-Sanabria mentioned before, the standard of care to correct structural abnormalities of the heart was surgery. Time have changed, and then now we have different tools and it's important because the prognosis of patients who are elderly, frail, has changed dramatically by the fact that we can use less invasive technologies and modalities to improve the quality of life and life itself, because they can tolerate all these procedures. So when is necessary? Well, that's what is important, the early detection, because the symptoms and the manifestation of the disease will show, and then the patient is treated. Or we can detect the severity of the obstruction or of the disease of the valves before the symptoms occur. And sometimes that will dictate us. So imaging, history, physical follow-up, early detection, all these things are important to tell us when to intervene.